Yes, my name is Mike, and at the time of making this video, I'm 66 years old. And as best I can, I want to talk to you about my journey through BPH up until I decided to choose Aquablation as my treatment and following the Aquablation treatment. So I started having signs of BPH about 20, 25 years ago, although at that time I really didn't know what BPH was. All I knew was that I was having trouble urinating. My stream was getting weaker and weaker. My urgency to go was more frequent. Um, I had trouble getting my stream started a lot. I had trouble emptying my bladder. When I had to go really bad, I would have a hard time getting it to come out, and then I would have to go right back to the bathroom again. And so it was just becoming more and more aggravating and more limiting to my lifestyle. So finally, in the year 2018, I decided to go and see a urologist. And I went to a practice called Georgia Urology, and I went to see a doctor. His name is Dr. Kriteman. And I went to the office, and he came into the room. He asked me what my problem was, why I was there. I told him very briefly. He shook his head and said, "It sounds very much like BPH. Here, let me give you a questionnaire." And so he handed me a questionnaire and he said, "Go ahead and fill this out and I'll be back after a while." So he left me alone with the questionnaire. I started to fill it out. About 20 minutes later, he come back into my room. He looked at the questionnaire. He shook his head and said, "Yeah, it seems like just standard BPH." And he says, "Here, I'm going to write you a prescription for a medication called Alpha Fusion, and maybe that will help alleviate some of your symptoms." And then away he went back to see other patients. When I left the practice, I was a little bit taken aback by how quick and how rushed he was. I mean, he didn't even take the time to sit down for a minute and discuss some of my symptoms and what was going on. And so I went home and I did a little research on the internet about the medication that he had prescribed for me. And according to the internet, I mean, there was a lot of side effects associated with some of these medicines, especially the one that he was giving me. Some of those side effects included maybe an elevated heart rate and possibly early onset dementia and things like that. And I'm the kind of person that doesn't like taking medications, and so I decided rather than take this medication right then, I would just continue to wait and live with the symptoms. And I did some more research on BPH, and sure enough, everything they said about BPH was exactly what I had. So I was pretty certain at that time it was BPH. Where earlier on, before I knew what BPH was, I thought maybe I just had a weak bladder or my bladder muscles were getting weaker, and that's why I couldn't empty my bladder, and that's why my stream was so weak. But in any case, I just realized that I had BPH more than likely. So after a year or so, and living with the symptoms, and they were getting gradually worse over time, it was even more limiting to my lifestyle. And finally, I decided I need to maybe do something else about it. So after a year, I went back to Georgia Urology, and this time they assigned me a doctor who was very nice. He sat down. We talked about my problem. We talked about some of the different treatments, the different medications. And he said before I started taking the medication, he recommended that I go ahead and do a cystostomy, that they have a look inside the bladder, just to make sure there was nothing else going on. And so I agreed to that. And about 2 or 3 weeks later, I had my cystostomy. The doctor looked inside my bladder, said everything looked pretty normal, but that my prostate was quite enlarged and that I had a medium lobe. And I could either go ahead and start taking the medication, which he said maybe you'd like to try for a little while. And he recommended a procedure called Aquablation. And he gave me a brochure about Aquablation. He said there's actually two procedures. One's called Aquablation, one's called Urolift. The Urolift would probably not be as good for me because of my medium lobe that he saw that I had. And so he recommended Aquablation as the way to go. I asked him if he'd been doing this procedure. He said at the present time he was learning the procedure. He observed a few aquablations and was just getting started doing aquablation himself. So I thanked him for the information and I went home and I started to do a lot of research on the internet. And sure enough, aquablation was probably one of the best procedures because it doesn't use heat and it uses water jets, high-powered water jets guided by robots. A robotic water jet to take away part of the prostate, to kill some of the prostate tissue and eviscerate it and wipe it away and maybe hopefully get it away from the urethra so that I wouldn't have the symptoms of BPH. So I also did some other research and I realized even though it was a fairly new procedure, it had now been done for about 2 or 3 years, so there was a lot of information starting to come in about the long-term results from Aquablation. And of course, you could listen to some of the urology websites from around the country, and of course the company itself that does the Aquablation, but you can't always trust that because they're trying to promote it. And so by then, a bunch of different journal articles had come out, studies had come out, and I read through most of them, and it seemed like the results of Aquablation were pretty good. The only two things that I didn't like about the procedure was that it required 2 forms of anesthesia. And one of my greatest fears is being put to sleep. Up until this point, I have never had a major surgery, and the only time I've been put into a light sleep was when I had my colonoscopy and given that propofol, and that went okay. I didn't have any bad reactions to that. So what really bothered me was that one of the anesthesias I would receive for Aquablation would be a spinal injection, which would make me numb and paralyze me from the waist down so that I would have no feeling down there. And the other part of the anesthesia was kind of a general anesthesia where they were going to use a laryngeal mask and put a tube down to the back of my throat. Now, not intubation where it went all the way down my throat, but just to the back of my throat, and give me anesthesia that way to keep me asleep and to keep me from wiggling or moving while the robot was doing its thing. And so, that seemed pretty extreme. A 50-minute surgery, 2 forms of anesthesia, etc., etc. And so I decided to think about it for a little bit. I took the alpha fusion. The alpha fusion did have some side effects that I didn't like. It definitely elevated my heart rate, made me, a little bit nervous, just a little bit keyed up. I didn't know, but I knew that it wasn't right. And after a month or so, it really wasn't helping my symptoms. So I stopped taking the alpha fusion. And I went about another year, and finally I decided that it was time to do the Aquablation. And so this time I did some more research on who was doing Aquablation. And the first doctor I saw, Dr. Kriteman, he pretty much led the way. He was a pioneer with Aquablation. He had probably done the most procedures with the practice Georgia Urology, and probably the most procedures of anybody in the state, or one of the most. And he also did a webinar, and I watched this webinar. It seemed very good, very professional, very interesting, and so I decided I would make an appointment and go see him. So I go and I make an appointment to see him, and again, he was very in a hurry, very rushed. He said, yes, Aquablation would probably help you. He understood why I didn't want to take the medications and the different side effects. And he said Aquablation is definitely the way to go. So I thanked him. Again, it was very rushed. He didn't sit down. We didn't talk very much. It was just, Aquablation's the way to go. And so I get home, and a couple of days later, his scheduling nurse gives me a call and says, we'd like to schedule you in for the Aquablation procedure. But COVID was at its height at that time, and I wasn't too comfortable about going into the hospital right then, and I still needed more time to wrap my head around doing the Aquablation procedure. So I told her that I'd like to think about it for a little bit. She said, that's fine. Just call us back when you're ready and we'll schedule you in. So I waited about 9 months, and I didn't do anything about it, just continued to live with the symptoms of BPH. And eventually I reached the point where the symptoms were just so bad, just so badly affecting my life and the quality of my life, that I decided, you know what? It didn't matter whether or not I was going to have the anesthesia or whatever. The research said Aquablation was good. This doctor seemed to be very practiced with this procedure and very experienced with this procedure, and so I decided I was going to go ahead and do it. So I called the scheduling person back, and they said since it had been a while since she had talked to me last, she thought it would be a good idea for me to go in and just see Dr. Kriteman again very briefly. So I went in and I saw Dr. Kriteman again. We talked very quickly. He stood up. We talked for a few minutes. And I told him about my nervousness about having that laryngeal mask. He says, oh, we don't do that anymore. Now we give you the spinal injection to paralyze you from the waist down. And we give you the propofol, probably the same thing that you had when you had your colonoscopy, just to put you to sleep so you don't wiggle or move while the robot is doing its procedure. So that was like a load off of my mind. At least I didn't have to have that mask or the general anesthesia anymore. And so I said, okay, I would like to go ahead and schedule Aquablation. So this time I spoke to the scheduler. They scheduled me for about 3 months out because he had a lot of procedures scheduled, and they also needed time to check with my insurance company and get back the approval to have the procedure. And so my Aquablation procedure was scheduled for May the 19th, 2022 at 8:30 in the morning. And so now I began the waiting process for that date to arrive.